Why is UPEC a main cause of bladder urinary tract infections? Have you ever wondered why certain bacteria are more likely to cause urinary tract infections? One of the main culprits is Uropathogenic Escherichia coli, commonly known as UPEC. This bacterium is responsible for about 80 to 90% of community-acquired bladder urinary tract infections. So, what makes UPEC such a dominant player in this field? First, UPEC has specialized structures called fimbriae. These hair-like projections help the bacteria stick to the bladder's lining. This adhesion is crucial because urine flow can wash away many microbes. By attaching firmly, UPEC can resist being flushed out and establish an infection. Once UPEC has adhered to the bladder, it can form biofilms. These are communities of bacteria encased in a protective layer. This biofilm shields UPEC from the immune system and antibiotics, making it harder to treat. Additionally, UPEC can invade the bladder's epithelial cells, creating what are known as intracellular bacterial communities. These communities can hide from the immune system, leading to recurrent infections. UPEC also produces toxins, such as hemolysin, which can damage host tissues and disrupt the immune response. It has developed ways to evade detection by the immune system, using surface polysaccharides and outer membrane proteins to avoid being recognized and destroyed. Iron is essential for bacteria to grow, but it is often limited in the urinary tract. UPEC has adapted by developing iron scavenging systems called siderophores. These systems allow UPEC to thrive even in iron-poor environments. Another factor is UPEC's motility. It has flagella that enable it to move from the urethra into the bladder and sometimes even up to the kidneys. This ability to ascend the urinary tract helps spread the infection. Interestingly, UPEC strains usually come from the gut flora. They can reach the urinary tract through contamination from the periurethral area. This transition from harmless gut bacteria to a pathogen is linked to genetic elements known as pathogenicity islands, which carry virulence factors. From a bladder health perspective, these features make UPEC particularly effective at causing bladder infections. While urinary tract infections caused by UPEC are common and often manageable, persistent infections can lead to chronic inflammation. This inflammation may increase the risk of bladder tissue damage over time. In summary, UPEC's success as a leading cause of bladder urinary tract infections stems from its complex set of virulence factors. These factors enable it to colonize effectively, evade the immune system, persist inside cells, and resist treatment. Understanding these mechanisms can help in managing urinary tract infections more effectively. Always consult healthcare professionals for personalized advice and treatment options.